The typical approach of dentistry to crooked teeth is simply that the average dentist is not paying any attention to growth and development. Now, if the dentist was trying to picture what this kid's teeth are going to look like 5 years from now or 10 years from now, well, then he'd be more concerned about growth and development. And if the average dentist would pay attention to a thing called the mixed dentition analysis, and the first and smartest dentist that I know that decided that he should take a look at this was Dr. Robert Moyers, and he wrote a book called The Handbook of Orthodontics. In this book, it explains how he recommends a mixed dentition analysis, starting at about age 6, where the youngster has 6-year molars, permanent teeth, and some lower front teeth, permanent teeth. You can measure those teeth and measure the space available, and from the predictive graphs that are in the book, you can predict how much space is going to be required for the natural teeth that will ultimately replace these baby teeth. If by so doing you find that there's a significant shortage, well, then what are you going to do about it? Dentistry's answer to that is you ignore it. Wait for the teeth to get so crooked that the parents say, what are we going to do about my kid's crooked teeth? And they're told, well, go see the orthodontist. Now, the problem started 3, 4, 5 years before that, but was ignored by the general dentist, and even the orthodontists aren't going to pay attention to that because it's not the way they do it. So the right way to do it is that you start evaluating this youngster's space and tooth size. The size of the teeth and the space available are the two factors that you want to know. Now, if there's plenty of room, well, then you can do nothing, and chances are the teeth will all grow into the proper place. If you're short of space, well, then the youngster's probably going to have crooked teeth. So why not start early in the game? Why not start when you can predict if there's going to be a space shortage or not? Well, in my opinion, dentists are too busy doing what I call drill, fill, and bill to be paying attention to growth and development. And therefore the kids wind up with a shortage of space, crooked teeth, and then somebody says, well, what are we going to do about this? Okay, well, we're going to go to the orthodontist. There's a little instrument called a Bully gauge. It's common, and it's nothing more than a little instrument that measures space. You can buy one in a lot of different places, and if not, you could get by, with just a small ruler. And with that book in hand, in the hands of parents, they could evaluate that themselves. You don't have to be a dentist to be able to measure this space and use the predictive graph, determine whether your youngster is going to be short of space or not. And if you can predict beyond any reasonable shadow of doubt that there's going to be a space shortage, well, then you start to address that when the youngster's 7 or 8. Shouldn't the dentist have the responsibility of examining carefully enough to predict ahead of time?